Today we are going to discuss about the drugs affecting our lungs. Drug used for the treatment of cancer, microtransplant, and immunosuppression causes scarring of the lungs called pulmonary fibrosis or interstitial phenomena. The patient suffers from breathlessness, non-productive cough, which can worsen if the dose is not followed. Amiodarone is a non-anti-cancer drug that also damages. So, in the drug treatment management, MTM, we have to consider the medicine which we are providing to the patient is not causing any harm. For example, aspirin and non-selective beta blockers like propranolol can cause an asthma-like condition, making it difficult for the patient to breathe. These should be avoided in patients with pre-existing asthma. In addition, any drug can cause a severe allergic reaction that will make an asthmatic attack. Now we'll see the effect of the drug on digestive system. Non-steroidal painkillers like brufen, dipropyl methylenic acid, postal, and corticoids are well known as stomach ulcer, especially when taken on an empty stomach. These phosphonates, which are used in osteoporosis, like alendronate sodium, used in the treatment of osteoporosis can cause oesophageal and are advised to be taken in an upright position. This is very important. So digestive tract should also be protected from non-steroidal anti-inflammatory as well as bisphosphonates which are used in osteoporosis. Diarrhea can be caused by nearly every oral drug, iron, salt, lacrimide can cause constipation. The liver is the site for detoxification. Some drugs, however, affect the liver, causing serious problems. High dose of the acetaminophen, like Panadol, and otherwise safe drug in normal dose cause liver toxicity, hepatotoxicity. Several first-line anti-tuberculous drugs, that is the INH, rifampicin, ethambutol, and pyrazimide, cause liver damage and reduce the option for the treatment of tuberculosis in these patients. Amiodarone, methotrexate, valproic acid are some of the other hepatotoxins. These drugs should be avoided in alcoholics and other patients who already suffer from these diseases, from this liver disease. Triglyceride an antidiabetic medication was withdrawn due to its liver damage effect. The drug affecting on the genital and urinary tract, male and female both. So we have to consider this also. Drug can affect different part of the kidney, causing a number of kidney disorders. These include glomerulonephritis, inflammation of the glomerular failure, which can be caused by a drug like a penicillin, NSAIDs, gold, lithium, and hydrazine, which is used in asthma. Acute tubular necrosis caused by drug like aminoglycosides, antibiotics, intercostal D, and acute interstitial nephritis caused by the penicillin and rifampicin, rifampicin used in tuberculosis. Cephalosporin and tacrolimus can cause chronic kidney failure. Damage to the kidney may reduce the activation of the several drugs through the urine. Hence, these drugs may need to be avoided or may require dosage adjustment. Erectile dysfunction is a side effect of a drug like the thyroid, which is a diuretic, long-acting diuretic, and antidepressant. Then, effect of these drugs on blood. Drug can produce anemia by reducing the production of the RBC cells by bone marrow. For example, chloramphenicol. These cells were used in the future in the last 2 decades for the treatment of typhoid. Chloramphenicol. Sulfonamides are also no banned. They are not using sulfonyls. And carbamazepine. Carbamazepine is anti-epileptic. They also cause blood dyscrasia and destroying the formation of the RBC cell by the process called the hemolysis to break down the RBC and Primaquine for the malaria, penicillin, and sulfonyls. Hemolysis is particularly a problem in patients with the deficiency of an enzyme called the glucose 6 phosphatase. Some drugs reduce white blood cells count and increase the chances of suffering from infection. These include metronidazole, phenylbutazone, and clofazimine. So these three drugs causes blood abnormality, especially white blood cells. Heparin, anticoagulant, has been associated with a thrombocytopenia. These reduces the platelet condition that lower the platelet counts in the blood and increase the chances of bleeding. Bone, some drugs affecting the bone. Long-term use of glucocorticoids can weaken bones, causing osteoporosis and increasing the risk of the fracture. Means if you are using corticoids, means steroids, they can cause osteoporosis and weaken the bone. The anti-tubercular drug ethambutol and pyrazinamide can increase the blood uric acid, causing a gout-like disease. Hormone condition, glucocorticoids raise the glucose level and causes a diabetic-like condition. Therefore, a history of drug intake is important with any individual who tests positive for high blood glucose. Amiodarone and lithium can cause thyroid problems, cancer, just affecting the cancer. Hormone replacement therapy can cause breast cancer. Diethyl estradiol causes vaginal adenocarcinoma in daughter of women affect the drug during pregnancy. Drug-induced diseases diagnosis. Drug-induced diseases are primarily diagnosed based on the history of intake obtained from the patient or the family. The symptoms should appear as a reasonable time frame after taking the medication. By default, physicians should inquire about drug intake. Any patient coming to the clinic with a problem of has not be missed out on drug-induced diseases. If the drug is administered, the symptoms may reappear. If the drug is re-administered, the symptoms may reappear. This is referred to as re-challenge. Re-challenge confirm a drug-induced diseases, but usually not done due to the ethical reasons. Drug-induced disease treatment. The first step in the treatment of drug-induced disease is to report the adverse effect to the physician, who may stop the intake of the medication or at times reduce the doses gradually and replace with an appropriate alternative. Many times, the simple step can relieve the patient of symptoms. Those who do not recover require additional treatment depending on the adverse events. Prevent drug-induced diseases, step that could help to prevent a drug-induced disease include always inform your doctor if you suffer from any illness or take any other medication, including nutritional supplements, before you are prescribed the medicine. Inform your doctor if you have suffered from any previous allergic reaction to a drug, any other substance like food ingredients. Take the medication only as prescribed by the doctor. Stick to the dosage duration of the treatment as well as other instructions like taking it after meal. Utilization of the clinical literature. A clinical drug literature is basically document containing all the information, including but not limited side effects, side or adverse effects, drug interaction, users, therapeuticity, stability, compatibility, drug identification and availability, dosage and administration, toxicity, pharmacokinetic, dynamics, pharmacogenomics, healthy related quality of life, health related quality of life. Pharmacoeconomics and efficiency include the comparative efficacy among drugs in same pharmacological chemical class as well as drugs from other class, assessing, reviewing, analyzing, evaluating, and interpreting the clinical drug literature are important responsibilities of the healthcare professional, and particularly for the pharmacists who are expert on the drug. The advances in computer technology, continuous growth of internet, and widespread availability of the database search capabilities have placed unprecedented amount of information into the individual graph. In particular, healthcare professionals are also now moving to internet information resources, but the key responsibility of the entire healthcare professional is to differentiate good from the poor quality. Importance of clinical literature. Information and knowledge needs of healthcare professionals as education is very important. Characterize, evaluate, and refine clinical process, develop, implement, and realign clinical decision support system, and lead or participate in the procurement, customization, development, implementation, management, evaluation, and continuous improvement of clinical. So we need each and every type of information, patient information, first of all, the basic. The literature evaluation is a skill developed with repeated use, learn to identify limitations, determine internal and external validity of a trial, why it is necessary to evaluate the structure, pharmacists question during ground on newly published research, should have a skill to decide whether to use the skill of the trial to the patient or not. Critical evaluation of literature by to include a drug into formulary to decide which information to incorporate into clinical practice. Systematic approach developed in 1975, strategies to teach pharmacy students drug information skills, 7 steps, 5 originally, secure demography of the requester. Whoever requests you must have a demography of the patient. Obtain background into that led the questions. Determine the category, categorize the ultimate questions. Develop a strategy and conduct research. Perform evaluation, analyze and synthesis. Formulate and provide response. And conduct the follow-up and documentation. These are the steps for systemic approach. Searching drug literature, best way to follow organized stepwise approach. Start from tertiary resources, followed by secondary and primary. Primary research means directly you are going to asking the question. Secondary is studying information from subject, and the tertiary is someone tertiary references, quick access, background knowledge of the topic, textbooks, compendia, hospital formulary, because it's previously made, references, and computer database. Review articles are also categorized into tertiary. If somebody has written an article 3 years, 4 years back, or a recent article, if you will go through, you will get more knowledge. Narrate review, systematic review, and meta-analysis. Drawbacks, out of date information may not be complete. Secondary differences very easy. Identify primary sources typically used when the tertiary sources is not out of date. For example, new drug, new use of the older drug. For example, indexing and attracting services provide citation of the article and abstract written by the author. Medline, PubMed, International Pharmaceutical Abstract. These are all available on net, and you can go through it and you can find a lot of information. Primary information means you have to go directly to the patient. More current, in-depth information required include studies like clinical trial, original report of the data, processing of the meeting, conferences, symposium, record of the organization, government agency, for example, annual report, treaty, constitution, government, document, speeches, survey, research, market survey, public option, video recording, television programs, websites, drawbacks, maybe biased. Drawbacks, what are the drawbacks of this timing? Maybe biased, means someone is adding his own choices, require a critical evaluation, important information may be missed if consulted solely, methodology flaw, evaluation of the clinical safety, evaluate the objective of the study, what is the purpose of the study, a researcher intended to examine goal stated capillarity, single objective and multiple effort group tested, evaluate the subject of the study, healthy effective volunteers, criteria for selection of the volunteers, evaluate execution of the treatment, evaluate the setting of the study, length of the study, physical setting, who collected data, evaluate method and design of the study, because the study, whenever you go for the research, you have to design this thing. It's a basic design, it's a statical design, there is a one variable, there is more than one variable, so you have to decide. Method clearly describe how you collect the data, how how you uh, collect the samples of your audience. Retrospective and prospective treatment allocation, patient design, crossover design means two groups, they cross over, one take the medicine and another take the medicine. Evaluate control, binding, random allocation, placebo, binding means the placebos are done with tablet rather than pharmaceutical action, comparison,